Hello. If you're a South Asian woman in her 40s, you may want to listen to this. I'm going to talk to you about a patient I have seen in my surgery just last week. She's 47 years old and she came to me with a view to have a follow-up appointment for her low back pain, which has been going on for more than a year. She's already seen a couple of my colleagues before. She had x-rays done. She was referred to physiotherapy, but none of that is making any difference. And on top of it, she started bleeding irregularly and heavy. And she was so worried because she was again referred for a scan, which showed that she had a few fibroids and a simple cyst in her ovary. And that got her worried. So when she came to see me, her main focus was on what's going to happen at this gynecology appointment and what's going to happen with my back pain. Because these issues were addressed separately in different appointments, different consultations, and not put together in any way. We started talking, and it transpired that she's also having severe hot flashes, both day and night. Nighttime one so worse to the point she was not having a good quality of sleep. But at this point, it's not something she came up with. It's something that I had to extract from her by asking specific questions. And again, the same about issues with dryness down below. Again, she didn't volunteer any information. It's something I had to specifically ask. I also talked about her sleep, how many hours she's sleeping. She goes to work by waking up at 4 o'clock in the morning, does her chores, and her job involves standing on her feet 8 hours a day. And when she comes back, by the time she does again her chores and goes to bed, it's around 10 a.m., 10 p.m. She doesn't have a large appetite, and she was so typical of her South Asian heritage in terms of how she's built. She was very slim with a BMI of 19. Putting this all together, we had a detailed consultation, and I came up with few suggestions because it was clear that she was perimenopausal and her symptoms, including her back pain, her irregular periods, lack of sleep, hot flashes, they were all interlinked, but she never thought they were linked, and we didn't pursue treating them together. We were addressing them separately, obviously. If I had seen her as a GP a few years ago, I would probably have done the same, where I would have focused on what she came in with, tried to treat her for the symptoms, and hope for the best. But now, as a GP with special interest in menopause and lifestyle medicine, because I'm also a lifestyle medicine practitioner, I learned a way to consult in a way that I see the big picture. I put things together. So we came up with a plan which included her doing a few stretches for all her joints first thing in the morning when she wakes up before she goes to work. We looked at her dietary plan and made some adjustments. I also started her on HRT because she didn't have any contraindications and she was somebody who would clearly benefit from it. And I see her 2, 3 weeks later in my clinic, and she was transformed. She was like a completely different person. She had a smile in her face when she walked into the room, and compared to the remember how I saw her a few weeks ago with a worry and a frown on her face, it made me feel happy. Obviously, it was not HRT that fixed all her problems. It's only part of the puzzle. And obviously, it's not just the morning stretches that solved all her joint pains. It's again part of the solution. And the same with the sleep and the same with the diet. So all different pillars of these health, they have to come in together to make the difference, to make her feel better in general in every aspect. And again, this reinforced my observations over the years that sometimes you have to see beyond what they come in with or what they say to you, because sometimes there are things that they don't talk about or they didn't think it was contributory. And unless you ask specifically, especially certain ethnic groups, they may not volunteer the information or even think that it's because of her body changing with the lack of hormones, the reduced elasticity in her bones, lack of strength because she didn't have much muscle mass. All these were playing against her and making her feel very unwell and miserable. So if you are a woman in her 40s and you have all these niggles or more than niggles that are making you feel not happy in yourself or making you feel unwell to the point where you're not able to carry on with your normal day to day things, it's probably time to speak to your doctor and see whether they can be interlinked or they are linked in any way.